So on the topic of oats, the only oats that are okay are certified gluten-free oats, and this is because of cross-contamination, as we mentioned before. When they've tested all sorts of kinds of commercial oats, they've tested as containing gluten. So if and when your healthcare team says that it's okay, only certified gluten-free oats can work. But most doctors want you to have a period where you know what normal is and your symptoms go away and your TTGs are normal before going down the path of oats.
Most oats are contaminated with gluten, and the protein in oats is similar enough to gluten that for some people, oats are a problem regardless.
One of the issues is cross-contamination. You can have a fantastically gluten-free food, or say, you've got a jar of peanut butter, which is gluten-free, except you put it on wheat bread, you stick it back in, you dip it again, and it's not gluten-free anymore. And so peanut butter, mayo, jam, hummus, butter, you name it, if it's touched wheat and you put it back, you're going to then have cross-contamination. And for a lot of people, cross-contamination is kind of what gets them. I was actually at one of my offices, and there was a nice buffet of different plates and different sorts of foods, and I was all excited because there's this big plate of raspberries. So I went over to grab a bowl, and one of my coworkers was slicing a bagel over it, which had never really occurred to me, and she was just trying to be polite by not getting crumbs all over the place. But knowing that most people don't have the sensitivity to realize, where they're getting crumbs and don't think twice. And quite frankly, I hadn't really even thought about that happening as well, but knowing that anytime there's food out and there's food around, there's certainly the potential for cross-contamination. And so it's in if you're using peanut butter, either having separate jars or having a single dipping rule, or the little glob thing where you've got jelly and you just lob it off the end, or something along those lines where you're not double dipping is the important piece. Cross-contamination can also be an issue with things like utensils. Basically anything that's touching anything with wheat you need to be careful with. Certainly in terms of things overall, the idea is, okay, if you have glass dishes or metal pots, those aren't porous, so you should be fine. But if you have, pots and pans that are really hard to clean out, or you always keep getting stuff stuck, those are things that it's time to give them to Goodwill, or fill in the blank, nearby college student, and get different ones. If you're doing something like a cookout, you always want to make sure that you're grilling the gluten-free things first, and always taking care with other things along those lines, and then scrubbing everything down carefully. Obviously, in a lot of ways, it's easier to have a household that's gluten-free, and yet, for some people, life is as it is. So even if you have a toaster oven, many of them have fans, which, as we saw, the size of the crumb that can make you sick, certainly the potential for cross-contamination in even a regular toaster is quite substantial. So the big things are, if you are going to have a household with both, labeling the food really carefully, using different cupboards, especially for small children, different shelves or things that are easier to see is certainly something that's important. And things like bulk bins or buffets or salad bars, even something like fondue, anything where you're going to get or risk getting wheat protein in with what you're having, it is essential to be careful for all those sorts of things because of cross-contamination. So another thing that has popped up over the last couple of years is the made in a factory statements. And these, first of all, they're voluntary statements, which means they're optional. So if you see something saying made in a factory containing wheat, and you see something not, they may actually have been made in the very same factory. So it's entirely up to manufacturers how they choose to label or not label those different things. There's a lot of controversy about what that means. The first important thing to know is there's something called good manufacturing practices. They are not actually having a food fight in the factories. There's, things are controlled, things are not all over the place. And yet there's certainly the potential for cross-contamination. And the potential is greatest with things like flours. Certainly the first study came out showing that, it came out earlier in 2010, that flours that aren't specifically marked and labeled gluten-free usually contain gluten. And this is because flour is airborne 24 to 48 hours. There's no way that they could be running batches of something on the same mill and not have cross-contamination. And so, when you hear about bakeries, and there are ones nearby who have a gluten-free day, it doesn't really work for someone with celiac because the risk of cross-contamination is just huge. So especially with flours, only getting ones that are certified as gluten-free, and preferably with grains as well, because the study also showed there is some cross-contamination grains, again, because they're using the same machinery. So even in addition to oats, many of the other grains have some level of cross-contamination. There's controversy whether or not people should use things made in a factory. At this point, my first preference is obviously using things from a dedicated gluten-free facility, using things that are tested specifically for gluten, using products that have, there are 2 different certifications we'll talk about in a minute, that are certified, which are batch tested to not contain gluten, and when possible having the naturally gluten-free foods, and checking in with your healthcare team where things fall in terms of the made in a factory statements. So the different certifications are, the most stringent is through the Celiac Peru Association, and their products contain less than 5 parts per million, which is, you know, the minuscule crumb that you can't even see. And so they're batch tested, and so you can be as sure as you can possibly be that those products are gluten-free. The gluten intolerance group also has a certification, which is less than 10 parts per million. And so that's also a way of knowing that, you know, people are paying a lot more attention, they're testing, they're on top of those different things. And so those, especially in absence of a national law prescribing what gluten-free is in this country and what that means, those are wonderful to know and to have that information. If and when the law in this country comes out in the US, it will be set at 20 parts per million unless they change things, but the proposed was 20 parts per million. This is just the beginning. Obviously, this is just an introduction, and there's a lot more because, you know, ideally you're on the gluten-free diet a long time because it's lifelong, which is ideally a very long time. So checking in with a registered dietitian is certainly something that's important and recommended by the NIH. And so there are listings here, listings of dietitians that specialize in celiac disease. Gluten.net has one, and in the American Dietetics Association, you have different things in people's profile in terms of what diseases that they look at. Certainly getting someone who's really familiar and works with the diet extensively makes a lot of sense. It is such a specialized area, and one of the dietetics practice groups actually has a specialty group on gluten sensitivity and celiac disease, so checking that people are a member of those things, if they're keeping up with the research, is something that is really important.